Okay, ladies, you've heard me say it so many times on this podcast, which is you have got to get to the root of the problem. We are seeing an epidemic of chronic infections right now, which are driving weight loss resistance in women. It's driving hormonal imbalance in women. It's making you feel like crap, to be honest. And we all want to go to the diet. We all want to go to the supplement to have that quick fix, or maybe even to the hormones, to hormone therapy. It's like, oh, maybe this will fix all of these problems. But when these things don't fix it, you have got to start digging deeper. You've got to start going, okay, could there be something underlying all of these issues? My guest today, she is the expert on all of this. She gets to the root of the chronic problems. Dr. Jessica Peatross has a passion for uncovering the mystery behind the chronic illness, whether that be stealth infections, heavy metals, stress, trauma, or other environmental toxicities. She's visionary for the future of healthcare and left her position as a board certified internal medicine hospitalist to pursue functional medicine in order to better serve her patients by getting to the real root cause answers for why the body might be malfunctioning. Her philosophy embraces that health encompasses the whole patient, mind, body, and spirit. And Dr. Jess has become one of the most sought after functional medicine leaders. She is known for her ability to help identify the root causes of illness, most often traced back to hidden stealth infections like Lyme, parasites, and mold. You can find her at drjessmd.com. So welcome, Dr. Jess. Oh my gosh, I'm so happy to have you here.
Thank you so much for that glorious invitation and introduction. I appreciate that so much. And yeah, isn't it? I love that you also help people get to the root cause. So
yeah, it's people don't want to go down that road because it's a lot to take on. And I myself went down the quick fix road in the beginning with my issues and thought, okay, is it the diet? And tried to, go to 50 different diets to try and lose weight, went to all these different things. And it just kept getting worse, getting worse, getting worse. And finally, I said to myself, oh my gosh, I got to start figuring out if there's an underlying root cause. And I did the visual acuity test for mold. And it said that I had, I didn't have mold, but that I was fighting something that could be heavy metals. And so I thought, oh, well, okay, I'll test heavy metals, even though I really don't think I have heavy metals. I have no mercury in my mouth. I live up in the mountains thinking I'm going to be clear, but I needed to check it off. And lo and behold, I was like off the charts with lead and mercury. And it was like, okay, this is what's driving all of this. And it was such a great aha moment. And it was, obviously a lot to take on. I'm still working on it, but I really try and push women now, like, look, you've got to find out if there's something going on that's besides what's on the surface. So I love that you do what you do. And now let's tell everybody why you're wearing these so cool sunshades. So for people that are just listening, if you look at the video, which will be posted on the YouTube channel and on the website, she's got her cool shades on today. So tell us why.
Well, yeah, you guys, I don't always plan my life as organized as you would think. And so I had this really cool treatment around my eyes yesterday called cold CO2 laser. And it's, it was painful yesterday. It looks worse than it actually is today. But what it does is it helps your own body recruit your own fibroblasts, your own platelets, your own body to produce more collagen and tighten the skin. So it's kind of asking your body to repair itself and figure out, hey, there's this integrity of the skin may not be as great here as it used to be. Let's pay attention to this area. And so unfortunately to do that, us women, sometimes I injured myself yesterday, basically. So today I'm on Stunna shades, I have no shame. It's cool.
Yes, it's great. I mean, we were just talking before we started to air all the things that women will do to, the anti-aging, and I've never even heard of this. So I think it sounds like it's quite expensive, but are you going to did you take before pictures and will you show after pictures like on Instagram or anything?
I will. I'm actually going to do a progression of days of
Nice.
how I look to see, because I would have never done it if it didn't last 2 years.
Yeah.
So I was
Yeah,
like,
which is way
man,
longer than Botox
right,
lasts, right?
right, which is I think what, like 3 or 4 months
Yes,
maybe.
3 or 4 months.
Yeah.
Yeah.
So I'm like, okay, it's probably, it's $700 to $800 around the eyes. I didn't do my whole face, but we'll
Still
see
cheaper than Botox. Like if you
over.
look at what you'd spend in a year.
Exactly. And this is building your own collagen for 2 years. So I weighed the risk, I weighed the benefits, I weighed the pros and cons, and this is what I came up with.
Great. And
Yeah.
it's just on this topic, actually, Dr. Jess,
Yes.
what's your thoughts on Botox?
So you know what? I did it once when I was younger, and as I said in the office with blood streaming down my face, I thought, and here I sit here with burns in my eyes, but basically I thought there has to be another way because I didn't really feel comfortable, and I'm not dogging it out for anyone who chooses to do it. I did it once, right? I'm not at all. But for me, just the idea of injecting botulism, Clostridium botulinum toxin, and to me, which the poison is in the dose. I get that. That's very true. But how many doses do you take before it's not good for your skin anymore, right?
Yeah.
And I've seen it wonder on people's face beyond the point of injection, and cause disfiguration. And so I've seen things happen with it before that just made me a little uncomfortable with it. Um, but if it's the right decision for you, then girl, more power to you, or guy,
Yeah.
whoever. Yeah.
Yeah, right. I know. I kind of wish I didn't know what I do with some things, right? And that's one of them is I used to do Botox for migraines and then it didn't work for that, but I loved
Oh,
what it did for my forehead. And I was like, oh, I think I'm going to keep doing this just a little bit in my forehead.
yeah.
And then I went and joined a Facebook group about Botox injury and all these women talking about, the issues they're having now from their Botox. And then there's not a lot of evidence coming out about it. There's a little tiny bit that says that it is obviously a neurotoxin, but
Yeah.
they haven't really been able to show what it's doing long term. There hasn't been
Correct.
anything.
We just know that short term, over those, 3 to 4 months, it paralyzes the muscle, right? And tightens the muscle kind of, right? And so what happens when we release that? Is there a rebound effect where there's more sagging? It seems to be the case for some people, right?
Yeah, I mostly just got it right on the bitch ditch right here in between my
I've
eyebrows.
never heard that.
I have a horrible bitch ditch, right?
Oh
The
God, I'm gonna
frown.
borrow that.
Yeah. But I haven't done Botox now for over a year. And within the last few months, I suddenly started getting this super dry, flaky skin right where the injection went, and it will not go away. Like I sit there and I pick it
Oh.
off, and I've exfoliated, and I'm gonna go see my facial lady. But I think it is. I think
Hmm.
it's a part of the toxin coming out. I think,
I
which is really
wonder.
scary.
I have never heard anyone
I
have this
have
like flaky skin
no,
afterwards.
I
I
haven't either.
wonder.
I
Huh.
know, scary.
You know what you should do? You should do like a bentonite clay pack right there. Like,
Ooh,
add a
yes,
little
and
bit
see
of
if it
like,
pulls it.
yes, exactly.
Yes,
That's what you should
nice.
do and see. Have an
I will.
experiment.
All right, sounds good. Okay, let's get to the topic at hand. Uh,
Yes. Side
First
note.
of all, why do you think we are seeing such an epidemic of Lyme, mold, parasites, and heavy metal toxicity? Those seem to be the four top things.
Yeah. I agree. And parasites for me too, which comes with Lyme, right? That's with the territory. So I will say I have had a progression in my career, and I will answer you differently than I would a few years back. And what that means is I used to blame the microbe. I used to say, oh, yeah, it's Lyme's fault that all these people are sick, or it's mold's fault that all these people are sick. But you know what? They're pointing to a bigger problem. Why are they in the body in the first place? Because there's so many times I can kill the pathogen off and the problem returns to the
Yes.
person, right?
Yep.
It's a relapsing problem. What is that? That is because the terrain is hospitable to the pathogen. So it is there for a purpose. What if we look at it from that perspective instead of it causing the problem, which I agree, a lot of bacteria produce byproducts and endotoxins, which make us sick. I agree with that. Okay, no one's arguing that. I'm saying, what if they're there for a certain reason? Because in the ecosystem in nature, we can see that, for example, bacteria are the great decomposers. They're there to digest and clean up organic waste products in the environment. And mold, the reason we found penicillin, for example, which is from penicillin mold, is because mold eats bacteria in the petri dish. So out in the environment, this is a grand ecosystem where everything's in harmony and certain balances and ratios. But here in what we've done in today's modern society is after the Industrial Revolution, we have just thought that man-made industrial chemicals are the best thing since sliced bread. They're better than anything out in nature and they can cure everything. And all you need is a petroleum-based man-made chemical pill to fix your chronic health problems, which accumulated your whole life. It's kind of a childish thought to think of it that way, right? So really and honestly, these pathogens are there because we are all toxic. And we have toxins, industrial waste products, phthalates, parabens, endocrine disruptors overrunning our drainage pathways and emunctories and our systems in general. And though they are there because the system is hospitable for cleanup. So the real problem, you said it in the very beginning, heavy metals, huge problem, huge. That's why I had yeast in my body when I went for my exam. Yeast on my dark field microscopy in my blood was because I was full of heavy metals, which they were there for cleanup, right? Industrial man-made toxins I just listed are another reason they're there. I feel another root cause is childhood trauma and continued stress. Being stuck in flight or fight that makes you sort of a sitting duck to get sick as well. So those are really the root causes that attract those big guns you just listed, the Lyme, the mold, the parasites. If you're one of those people that can't get better, what is it about your body that is making that microbe stay?
Wow. Yes. Do you know who Annie Hopper is?
No, but tell me.
Oh my goodness. So you're going to have to know who she is. I interviewed her, and so she was extremely sick. She was exposed to chemicals, like really hardcore chemicals, and her whole nervous system just shut down. She got stuck in fight or flight, and everything. She's became like super overly sensitive to any smell. She had to live in a boat, like away from her husband, her house, everything. Like she had to remove herself from society. She was wearing masks at all times. And she went to, a bazillion different doctors. They told her she's got heavy metal. She probably has mold. She's got all these, and they tried to treat. And she finally realized it was in her brain, that she had to get herself out of this fight or flight state. And I remember talking to her about it. And I said, well, should somebody be, clearing out the heavy metals if they do have them at the same time that they do this brain work that she does? And she said, she said, you do the brain work because then the body will let go of the toxins. Mm-hmm. And I was like, and that's what happened, what she did. And she got herself out of that state. And I just was like, it was this huge aha moment. And it was like, isn't that interesting that could drive that is crazy or support it. I don't know what, but they go together.
Yeah. You got to think about how a lot of people, they don't go to what they want to in life. They go back to what's familiar. Mm-hmm. And so people have had a lot of chaos in their childhood, a lot of trauma, a lot of drama, all that stuff. They go back to that in adulthood, not because it's what they want, because we become the energy of the household we are immersed in, right? So we're used to going back to what's familiar. And you have to think about, that chaos, that up and down, those peaks and valleys, that starting and initiating drama because you had that as a child, that sets off certain neurotransmitters from our brain. That lets adrenaline release from our adrenals, right? That lets epinephrine be released in norepinephrine, right? And that spins our dopamine a certain way, which is tied to these two, right? Dopamine, epinephrine, and norepinephrine are made from dopamine. So all of these things are triggered by certain thought patterns and certain ingrained patterns from our childhood that we then seek out and ping. And so if you look at it that way, it makes sense as to why, and there's been tons of studies done on inflammatory cytokines and high inflammation based on thought patterns, that those studies have been done.
Mm-hmm.
So it is all linked. And our primitive, very primitive, archaic studies and the way we design things are finally starting to catch up. So it makes sense to me that a lot of these people would have to heal that part before they could heal the rest of their body. You know, the trauma can absolutely set off inflammation cascades in the body.
Yeah, and we can become addicted to those dopamine and the norepinephrine, and it's a very addictive chemical that's released in our brain. So if you're releasing those, even though it was through trauma, and you think, well, why would I want to stay there? But we will return to that behavior to get that payoff in the brain. It's a crazy
Yes.
thing, and it mostly goes over people's heads, but it's very true. And I tell people that you can be very addicted to your illness and to feeling this chronic illness.
And not on a conscious level
Exactly.
almost.
Yeah.
And it's really, like you said, it's so hard for people to wrap their brains around that. You want to be like immediately like gut check, that's not me. I
Yeah.
don't do that. I run from that. But like ultimately you'll start to see that the patterns play out in your life over time. Not that I want to give anyone a bad foreboding here or anything, but you know, you have to become the observer of your own thoughts, and then that makes you the observer of your behaviors throughout patterns in life.
Yeah. Yeah. Exactly. I'm so glad you mentioned that. So, what about when it comes to people's detox pathways? Like some of us genetically have great detox pathways, or we'll have some that are good, some that aren't. How much does that play into this now?
So much. Oh my gosh, like detox and drainage pathways are everything. That's really where I beat my drum, is on this very topic you just brought up. You know, and I'll explain it so everyone can understand it here. So your natural, well, what doctors call emunctories, which are drainage or detox pathways, they're God-given pathways, right? They're things like your lymphatic system and your bile and your bowels. You know, the reason you guys go to the bathroom and have bowel movements every day is to release toxins. That's the whole reason. And then, you know, sweating, it cools you off. It also releases heavy metals and endocrine disruptors. So there's all these, you know, breathing actually detoxifies you. Urinating is releasing toxins you don't need anymore. So there's all these ways your body releases things that are not serving it or should not be in the body very long. And so unfortunately in life, we can be genetically predisposed certain ways. Trauma has been shown to change genes as well, adverse childhood events and things like that. So there are different ways that our genes can be pressed on or off based on our environment. And that's called epigenetics. And certain people will have problems if their drainage or detox pathways get overrun, if their genes get pressed a certain way because of negative exposures, then their liver may not be able to process and dump toxins like it once would because it's working so hard. It's working overtime. And you got to think about all the medications, all the toxicities that pass through our bloodstream that the liver is responsible for detoxing. And just one example to drive this home for people is something like non-alcoholic fatty liver disease. 20% of the population has that, and it's obviously not from alcohol. It's called non-alcoholic. So what's it from? Studies are showing it's from things like mercury and high fructose corn syrup and mold.
Wow.
Yeah, and so that's a stagnant drainage pathway or detox pathway that absolutely can be reversed so people feel better, and that will lead to people have these mystery symptoms and feeling chronically ill.
We have an overabundance of mold in the environment compared to 10 years ago, 20 years ago.
Yes.
Okay.
And that's a great question. I would say it's not because the natural habitat and environment necessarily has changed, but our modern day building practices have changed. And so in the late 70s, early 80s, you know, we started, and even earlier than that, and actually in the 60s, I believe, 60s, 70s, we started using things like gypsum, which is another name for drywall. And ironically, when drywall gets wet, there's nothing dry about it. It doesn't dry. And so there's a certain type of really toxic black mold called Stachybotrys that loves the cellulose content of gypsum or drywall. So then you get it wet, it's the perfect habitat. And you have to think about the way we're building energy efficient homes, which are usually very airtight. There's not airflow. There's nothing natural about that in nature, where everything is kept in checks and balances with proper airflow, proper sunlight, which helps to disinfect, right?
Mm-hmm.
All these things that nature provides, we have sort of messed up with what we've seen the best way to build things. And we're using all these toxic building materials now, things like volatile organic compounds and adhesives and paints and carpets and flame retardants. And it's no wonder that our very intelligent bodies are reacting appropriately.
Yeah, I'm so glad I live in a log home.
Right?
With no carpet anywhere.
Good. And just you gotta just open up those windows every now and then, right? And I know log homes take a lot of doesn't it take a lot of upkeep to keep
Log
it?
homes,
Yeah.
it gets very dusty, that's for sure.
Yeah.
So that, and yeah, you have to upkeep the outsides of it, but I love it.
I love it too. And honestly, that's kind of what we have done in modern day society. We've tried to make things convenient and cut corners and be cost effective, cheaper and more convenient for us. And nature's like, it's not the way it really works.
I've heard before that mold, you can be exposed to mold as a child, but then it can lay dormant in the body and then it can come out in adulthood in stressful events. Is that true?
I've never heard it said like that, to be
Okay.
honest with you. That's very interesting. I'll tell you, I do believe things can get sequestered in the body. Things like thyroid nodules or ovarian cysts, in my opinion, are the body walling off toxicities away from the bloodstream to protect you.
Wow.
What a smart way to perspective to look at the body, instead of, we don't know, the body's just stupid, why is it doing that, it's wrong. I disagree. So I'll give you an example. Lately I've gotten into neural therapy, which is injecting scars and tonsils, because the tonsils are the gateway to the lymphatic system. As a child, I was exposed to mold growing up in my childhood home. I also had a ton of strep throat and ear infections. I should have had my tonsils taken out and tubes put in my ears. Thank God I didn't. But when I went to have my tonsils injected, they inject them with procaine, a local anesthetic, and homeopathics, which are sort of like liquid acupuncture. They send information to the body and tell the body's main organs to drain the lymphatic system. So I'd had injected 2 other times. On the third time, the right tonsil that was injected, which is where most of my sore strep throats were, shot pus out of the person injecting it.
Oh my gosh, that's so exciting.
She was like, bleh. But I don't blame her, right? But, I wasn't sick. I didn't feel bad. That was sequestered in that organ, in that gland, for I don't know how long that pus was. I don't know how old that pus was, but it sure as heck didn't belong there. And since then, my entire body is drained. My voice has changed a little bit.
Wow.
Yeah, so I do believe that the body can sequester things like mold, especially in something like sinus cavities. Or, think about all the sinus cavities in here. If you're someone who consistently has sinusitis, 2-3 times per year, we're so sore to touch here, and antibiotics don't help you. What is that? That's probably some sort of fungus or yeast. And so these are clues as to how you might have had something sequestered in your body for a long time. I would say if you're one of those people that has had it for many years, you would be very, very rare if you didn't have signs or symptoms of something flaring every year.
Right.
Yeah.
And how often do these stealth infections go together? Because I've also heard a lot about like that mold or Lyme will hide inside heavy metals. that true?
Yeah, I've actually heard it, metals and mold spores inside parasites.
Okay.
A lot of studies show that parasites can hold twice the heavy metals you would think like something like a fish cestode would hold. This is in like animal studies. And they also show that they hold viruses as well. There's some studies that show mold spores. So parasites seem to be the main thing here, but yeah, you're right. I call them frenemies in the toxin bucket, and they all just sort of add up and work together to take over your immune system. It's a lovely evil genius orchestra. So yeah, I mean, you won't forget that now. They work together. Rarely are you going to find mold alone in the system. Rarely. I mean, I almost always see people with mold's younger dirty cousin, Candida.
Yeah, same with heavy metals. Like people will start
Yes.
chelation and they start having these massive candida flares.
Yep, it's awful. Think like puffy, itchy. You want to eat like a whole pound of sugar in the evening. Yeah, that's candida.
Wow. Yeah.
Yeah.
So great.
Yes.
When it comes to the Lyme, I find this one very intriguing and it just baffles me because it's, supposedly it's from the tick, a tick bite. So are we just having this epidemic of suddenly everybody's getting bit by a tick? Never before this was happening? Like, what is this?
Karen, you have too much logic. Stop thinking.
I
So stop. So great question again. I will say that is rubbish that it's just from a tick. There have been a lot of really well-designed studies done out of Germany that show that you can actually get it from mosquitoes or mosquitoes as well. And they show that the bacteria, the spirochete, can actually survive from the larval stages into the growth of actual mosquito. And who remembers a mosquito bite? That, you know what I mean? Like, and only 60%, 70% of people develop a bullseye rash. I mean, and it may be, that's a high estimate. Actually, it's more like 40 to 60% develop a bullseye rash. And so that's diagnostic of Lyme. But if you don't get that, who remembers a mosquito bite that they think is going to be problematic? Not many people. The way you can kind of tell sometimes is if you have this really weird abnormal reaction to the mosquito bite, where it like welts up super huge and is like, monstrous on your body. And you might get like swelling and redness that's really just abnormal around it. That might be an indication that your body is really overreacting to something there for some reason. And remember, my perspective is the body is never wrong.
Mhm.
So why is that?
Right.
Yeah.
Why do you think these things can drive weight gain and weight loss resistance? Have you seen any research on that?
Absolutely. It really depends on what frenemies are in the toxin bucket, right? So, some parasites can cause weight gain, some can really steal your nutrition and cause weight loss and cachexia and wasting. So it really depends on what frenemies are there. But let's take mold, for example. Mold destroys leptin cells in the brain, which then makes sure that's the receptor that tells you when you're full, right? So your body's natural response is to upregulate the receptors in the body. So people gain weight on this low amount of calories that doesn't make logical sense to them when they're in mold. And then, as far as Lyme and things like that go, in general, it's just an abundance of inflammation. The body, the spirochete is really clever and it doesn't hide in the blood or it would be found most of the time. It's usually in the synovial joint fluid, the lymph, the fascia, other places like that. And so that's just massive inflammation that's coming from everywhere in the body that's hidden. And when there's inflammation like that, especially if it's in the digestive system, you're not going to be very good at absorbing your nutrition, minerals, and vitamins from your food. You're not going to be very adept at that. And so a lot of times people will tell me they have these stellar diets. I'm like, dang, their diet's better than mine. You know
Yeah.
what I mean?
Yes, I do.
And then you look at their actual nutrition and some of their NutriEval or whatever, their blood work, and you're like, holy cow, they look like so malnourished. What is this? And I never, it's very rare that I think that my patient is lying to me or my client is lying to me. So very, very rare. And so I always err on the side of what else is it that I can't figure out. And what I've seen over the years is that it's such an inflammatory response or an inflammatory response in the digestive tract that they are unable to properly absorb things. So when it gets to that point, what's really helpful for those people sometimes is giving them powders or liquids.
Right.
Yeah.
Interesting. Yes.
Yeah.
Do you think everybody should be tested for parasites, mold, Lyme, and heavy metals? Like how prevalent is it? I've heard it's at least heavy metals is extremely prevalent, I've heard, and parasites.
Extremely.
Like Dr. Todd Watts said, when I said, well, how many people have parasites? He's like, everybody has parasites.
Okay, so that may sound ludicrous to some people out there listening, but let's just put it in perspective really quick. So, like you deworm your dog every 6 months to a year. You just do. Something you do. You're like, oh, dogs have parasites, duh. So like you're also a mammal. Our food supply in the US is not that great anymore. Like it's just not. So let's be real here. And then also, if you look back in history, our indigenous ancestors knew to parasite cleanse at least annually as well. So what did they happen to know? And yeah, I would agree with Dr. Watts in saying that 70 to 80% of people have parasites at some point in your life. You're probably going to have one, and the tests are extremely inaccurate. So even though I would love to have people tested for parasites, it would probably be a wash, because most of the tests are not always the most accurate thing, just sort of like Lyme testing.
Yes.
The functional tests are better. Are they perfect? Heck no. They're not. I go more by what the body is telling me in very specific questions that I go by in like an hour and a half. There's no shortcuts to this. And the body will usually tell me based on very specific questions I have. I do feel like everyone should test their home for mold.
Right.
I think that's important. I do think that because 80% of previous homes have water damage, 43% of current homes have water damage. So gosh, that's a bit, and we spend 90% of our time indoors. So like nowadays, so this is something that should be on our radar. Heavy metals, yes. Mold in the home, yes.
What about the mold acuity test, the visual acuity test? That's apparently 95% correct.
I found that people who have parasites and Lyme will also sometimes fail that test because that affects their vision too.
Okay.
So it's just a test for all of those things. And yeah, it's like $12 or whatever.
Yeah.
So it's affordable.
It's a good
for
starting
everyone.
point.
Yeah, that's easy. It's a yes because of the cost and accessibility. And then one that I think everyone should be tested for is environmental toxicities. A good environmental tox test to see the total tox burden, because that's ultimately why the Lyme, the parasites, the bacteria, the yeast, everything is not going away in your body.
Right. They're putting in roots. They're building a home in there.
Oh my God, yes.
What's that test? What's it called, that test?
So there's a few of them, but my favorite is the Total Tox Test by Vibrant Labs. And then Great Plains Lab also has an environmental tox test too. It just doesn't test quite as much, but they test things like pesticides, like 3-4 different types of pesticides, glyphosate, which is Roundup Ready, the different plasticizers and endocrine disruptors like BPA and things like that. They test for some flame retardants and it's really important. It's a nice test.
Yeah, I would love to do that test actually. What about the GI map? What's your thoughts on the GI map for gut test?
I love the GI map. I actually have a full course on it in my Wellness Plus membership. I have a full hour-long course about how to be a pro to read it yourself. My only problem with the GI map is it's a PCR test. And we've seen the drawbacks of PCR in the last couple of years.
Thanks to COVID, the PCR. What does PCR stand for?
Polymerase chain reaction. So what that means is they find what they're doing is when they take the sample, when they take your guy's crap, okay, when they take your poop and they take it to the lab, they take and they look and they examine it in microscopically, right? And what they're looking for are certain strands of certain lengths of amino acids or nucleic acids, which indicate that there could be a certain parasite, a certain bacteria, a certain pathogen in your poop. And what PCR polymerase chain reaction does is it doubles that nucleic acid, and then it triples it, and then it quadruples it, and it goes exponentially, like adding 2 grains of sand, 4 grains of sand, 8 grains of sand, 16 grains of sand, until it blows that nucleic acid section up and pieces it together to say, this is what it looks like.
Okay.
Make sense?
Yep, I think so.
Kind of crazy, right? Like, who thinks these things up?
Yeah. But it is the better of the gut tests, is it not? Like when it comes to, you get it through your doctor, well, you'll say, test me for parasites. That's not a great way.
Because what your doctor is going to do is, again, take your guys' crap, take your poop to the lab, and they're going to do something called an O&P, which stands for ova and parasites. And they have someone manually look through it through a microscope, and that's really it. So to have it even close to accurate O&P stool test, you really need to perform that 3 to 4 times over the course of a week or two, to get the efficacy a little bit higher from just someone looking at it with their naked eye, right, under a microscope. So
yeah, I did two. I did a one through my doctor, a stool test, and then one through my naturopath. And it wasn't the GI map, it was a different one. I think it was through Genova or Great Plains. Like, no, I think it was Genova, but it was a more comprehensive gut test, which showed I had was riddled with blastocystis.
Oh no!
But then the one that my doctor did through the stool test showed nothing.
Nothing. That's very common.
Yeah.
Very common. And blastocystis, that's the thing. If it's on the border with a PCR test, I don't worry about it. It could definitely be a false positive. But if you're off the charts on something, holy cow, we've caught something. You know what I mean? So off the charts in blastocystis, that's probably not an error. And blastocystis is a parasite that's really connected to Hashimoto's.
Yes, it is. Yes, I've read that before. Yeah. So very interesting. It's also one of those ones that's like Candida, I think, where it's okay to a certain amount. Like there's a lot of places around the world, like different countries, that everybody has blastocystis and they're living with it. H. pylori, another one. Yes.
Mm-hmm. Yeah. So it makes you wonder when do these things become a problem?
Yes.
I firmly believe it's a certain toxin they're going after. That causes them to go into kind of overdrive and produce byproducts.
Right. Yeah, that makes sense to me completely. I love that take on it, that view of it. It's different. I like it. Okay, testing then. Okay, so for mold, you'll say we could do the visual acuity test, symptoms, and then what about actually testing for the mold, which is quite costly? Is it accurate?
Great question. I love all your questions. So it's nuanced. I will say that. I would never just take a urine mycotox test, which is how we test the body. I would never just take that test without symptomatology, without talking to the client or patient and seeing if their symptoms matched, if it was even relevant, because ultimately there can be people exposed to mold, but if your body works right and it recognizes it, you're going to pee it out really quickly. You're going to pee and poop it out, which is what we want. So sometimes those numbers can look really scary, really high on one of those urine mycotox tests, but the person feels great.
Yes. Yeah.
Right.
Same with the blastocystis and H. pylori. It's like I've had people where that shows up and I'm like, but do you have digestive issues? Are you having diarrhea? Are you having heartburn from your, and then they're like, no, I feel great.
Right. Right. I don't like to chase things that aren't complaints for people, and just because the numbers make me feel better. It's if it's off the charts, it's whopping numbers maybe, but otherwise, I really need to match that test, that urine mycotox test, which comes from Vibrant Labs or Great Plains again. I need to match those tests with, are you getting up in the middle of the night and almost running to the bathroom and peeing on yourself? Are you short of breath intermittently for no reason? Do you have post exertional fatigue to the point where you don't want to work out? Do you have pins and needles sensations on your extremities? How about brain fog? How about rashes or eczema? If you are experiencing these type of things, or more than one person in your house is having abnormal symptoms, then gosh, this test might be relevant, right?
Yeah.
And
Yeah.
then really, if you want to be as scientific as possible, then you get an ERMI test, an environmental relative moldy index test. My favorite company is EnviroBiomix. It's a really stupid name, EnviroBiomix, but what they do is they do an ERMI and a HERTSMI, and they don't just look for mold in a water damaged home. They look for gram-negative bacteria and gram-positive bacteria, which absolutely can cause disease just like mold can. So they cover every base on the air test for your home. And then you take that air test for your home and you match it up with that urine test from your body. And then you say, oh my gosh, there's the same species of mold. And I'm sick and my kid is acting crazy because waking up at night, not sleeping. So this is the answer.
Yes. Oh, and how great would that feel to somebody that's been running into all these chronic problems, all these little nagging symptoms that they think are not related. They can't lose weight. They've got insomnia. Their kids got insomnia, is acting out. Like put these puzzle pieces together to figure it out. I think that would be such a, oh my gosh, thank goodness I found this out, right? And putting it all together instead of going after one individual thing. I'll take a supplement for this. I'll take a supplement for that. I'll diet for that.
Green pharmacy. I can't stand it. It's no better than conventional pharmacy.
Yeah. Yeah. I'm terrible. I look like I have a supplement shop in my kitchen, and I just shake my head at myself. I'm like, Karen, you know better. Like, stop. Which I have. For last year, I've refused to buy anything else. But
yeah,
I have just so much in there from my history of trying to figure out my health problems.
You should do at least make a good use of it. Make some sort of like funny reel or something. Make fun of yourself about it. Something.
I should. You're right.
Yeah, you should. Because now I agree with you completely. That's like my biggest pet peeve now. I feel like really people should be on no more than like 6, 7 things at once. House, can you tell what everything is doing? And if things aren't doing what they should be doing, it's maybe because you're swallowing capsules of fillers every day. I don't know. Just a thought. Like 30 of them in your gut every day can't be good for you.
No, absolutely not.
Yeah.
How do you test for heavy metals?
So heavy metals are tricky, right? Because a lot of people, and I'm not knocking it, but a lot of people like urine provocation tests where you take something like DMSA, DMSO to provocate out the urine or the metals out of their hiding places in the body so that you pee them out. I don't really love this technique because it re-exposes the person, kind of like
can redistribute it.
Yeah, kicks up dust at the construction site. People can experience some of the side effects of things like mercury or lead, which is stuff like anxiety and insomnia and irritability. It's really not fun. And so I just am careful with that. I prefer, even though there are drawbacks in its own right, I prefer a hair heavy metal test. And my absolute favorite thing to do is bioregulatory medicine from Switzerland and Germany, where they do just a blood pinprick on the finger, and they take your blood and do dark field microscopy, which is where, right, they turn off all the lights except for one light looking in on the blood. And then what you can see is cell wall deficient bacteria. You can see yeast. There's almost like it looks like a silver metallic sheen, like a mercury sheen to the inside of your red blood cells that have metals inside of them. And so what we saw with mine was a lot of metals inside red blood cells and a lot of yeast that were there helping to digest the metals that we just witnessed. And so that's a good way without re-exposing.
And that would be through you, like through a doctor. It would have to be.
It's usually through a bioregulatory medicine clinic, which is the medicine from Switzerland and Germany that I was just talking about. But you can also probably just Google dark field microscopy and someone in the area, because some people just know dark field microscopy. You can study that on your own account, on your own accord, without knowing biologic or bioregulatory medicine.
Dark field microscopy?
Yeah, that's it.
Okay. I've never heard of that before.
Yeah, absolutely.
Is it super expensive?
No, not for that, because it's literally a pinprick and then just looking at your one blood droplet under the microscope.
Wow. Yeah,
Hmm.
I've only ever done, because I dye my hair, I've only ever done the provocation test. And I have heard that that will overshow. Like that, because
Hmm.
they're pushing it out,
Yeah.
you're going to overshow. You're also not going to get an idea of what's going on in the brain, because that won't bring it out of like DMSA, EDTA,
Correct.
DMPS won't cross the blood brain barrier. And that,
Correct.
yes, some people can get very, very, very sick from redistribution of the heavy metals. But then the hair test, it's only showing um, 3 months worth of like actual exposure. And so and then you have to look at the mineral derangement to see, is there really heavy metals? So it's really getting somebody that understands how to read these tests. And I find people just don't take that as like, yes, you really do have heavy metals. When somebody says, oh yeah, you've got, this derangement in your minerals. So yes, you're definitely mercury toxic. But then the actual mercury bar is 0. And they're going, do I really
Yeah.
want to embark on this journey of heavy metal detoxification and chelation? And they're usually going, I don't think so. When the
Right.
provocation test, like for me, seeing that my mercury and my lead were at the very top end, as high as it could go, I was like, oh my gosh, I have to do something about this.
Right. It's like
So, and
alarm
I didn't get
bells.
sick from it when I did the test. Like I didn't
That's good.
feel bad, or
That's
I didn't
good.
have a horrible redistribution of it. So
That's good.
yeah, it's always like heavy. It's such a, it's not an exact science yet. And then the whole method of chelation is a whole nother discussion in and of
No,
itself. Do you have a
yeah.
specific protocol you follow for heavy metal chelation?
For me, chelation, like IV chelation would be last ditch effort. But yeah, it's just opening drainage pathways for me. The body knows how to dump these things out of its own accord. It just needs to be encouraged, and I need to move out of the way. So, like sweating, you can get mercury, cadmium, nickel, things like that better out in sweat than you can feces or urine. There's been a number of small studies that have shown that. So really, so many people tell me they can't sweat, which isn't normal. So I take something like HMET, heavy metal environmental toxicity binder from Cellcore, and get in the sauna, right? And do a bind sweat for something like that. A lot of lymphatic work. So manual manipulation of the lymph system, drainage of the lymph nodes, which is easy, soft, gentle, massage of the lymph nodes and all the different lymph node areas will help people drain. Something like lymph massage, myofascial release, breath work, which is, the lymphatic system doesn't have a heart. It only has the diaphragm, which moves it. So if you are shallowly breathing, you're definitely not moving your lymph, which is the sewer system of the body, which is where most of the heavy metals, most of the microbes, most of the toxins in the body are going to be stored in that lymphatic connective tissue fascial network.
And what about, can you tell us some of the supplements that you would use to open up those drainage pathways to help get rid of these infections and toxins?
So even before I put people on supplements, the first couple of weeks I'll have them doing extracurricular activities to open drainage pathways, because there's so many people who are so sensitive. They tell me they don't do well with supplements.
Yeah.
Okay then we're going to get you up in the morning and we're going to walk you first thing in the sunlight for 30 minutes every single morning. And then after that, I'm going to have you we're going to save up to get a sauna, whatever you can afford. And I'm going to have you put a castor oil pack on your right upper quadrant on your liver to open up the liver and bile, and then get in the sauna. And in the meantime, you're going to drink some really clean electrolytes and some filtered water, right? And then I curtail their diet, which is usually already curtailed at that point. They've already eliminated inflammatory foods because they want to feel so much better. That's all they can do. So if that's taken care of, then I'll do things like, possibly rebounding or dry brushing or lymphatic massage, like I mentioned, an hour of breath work on YouTube. And they do these type of things for a couple weeks. And then once that's done, I'll put them on something that will help open the liver, so something that has, especially if they have problems with digestion, a liquid supplement is really great for that. Something with milk thistle, dandelion, all, licorice, all the different liver herbs. And then something for bile, I really like Tudka, made by Cellcore, which helps to thin the bile. As in the meantime, they're still doing castor oil packs, which also helps with that. later on I'll add enemas for people as well, especially if they end up constipated. But usually castor oil packs in the abdomen help with that as well. And then they're continuing to sweat every day, which is triggering their lymph and mitochondrial pathways, and continue to walk in the sun, which is also triggering their mitochondrial pathway and getting them to breathe and detoxing their lungs. And so then really after that, I'm adding a binder. I'm adding something for just probably mineral replacement, really nice minerals. And then something eventually for energy or mitochondrial replacement if there's someone who's really fatigued and tired all the time. And that's really kind of my first month plan with people, at least.
Yeah. And then because I know that you have a method, it's kill, bind, sweat. So
Yes.
when are we killing? At what point do you start to really hit things hard?
That would usually be a second tier to my treatment plan. Usually at bare minimum month 2. Some people need longer for drainage pathways and to kind of open their system up. Sometimes they need 2 months, which is just fine for them. So it's usually month 2 or 3, depending on the person. And that is usually when I prefer to do an herbal antimicrobial, to each their own. There's not really a wrong way to do this. Sometimes people are not ready to kill. They still need liver work. And sometimes I'll add a liver supplement right then, and then a binder, and then get them in the sauna, right? So we're opening up the liver, spilling things out, mopping it up with a binder, and then sweating it out through the sweat pathway in a sauna. You can also do that with olive oregano and cloves. You can do it with so many other things, right? So it can be a natural antibiotic. It could be a liver detox. Just make sure you add a binder and you're opening up one of those detox pathways so you're not holding on to what we're killing and binding.
What's your favorite binder?
Personally, I can't beat Cellcore's binders. They're activated carbons. They are...
They use a lot of like fulvic and humic acid, right?
Yeah, I love it.
Yeah.
But, they turn on a lot of different great pathways in the body, biochemical pathways in the body, which help to heal. But it's not just the fulvics and humics. They add amino acids, electrolytes, and polysaccharides. So it kind of charges the binder in the beginning. It's sort of like a fire that's still simmering. It has a lot of potential, and so the body wants to react with it immediately when it goes inside the body. It's not like something like activated charcoal, which is sort of like the fire has gone out, right? There's not enough there's not potential or a charge there for the body to want to react with that. So it doesn't work as well. It doesn't bind as well as some of their binders with activated carbons.
Right.
Yeah.
And do you one last question?
Sure.
I wanted to just pick your brain. When it comes to the heavy metal chelators, when it comes time to pull out these heavy metals, I've spoken to Dr. J and Dr. Todd Watts about this, and I know that Dr. J Davidson. So for those that are listening, these guys are the ones that own Microbe Formulas, and yes. I love their product. I think it's one of the best products out there to get rid of, Lyme disease, mold, things like that, parasites. These guys know what they're doing. It's a very high quality product. Dr. J and his wife did the heavy metal chelation protocol by Andy Cutler. And I remember Dr. J saying, you definitely don't have to do that anymore. The getting up, like the protocol itself is you get up, you take these supplements every 4 hours around the clock. So even in the middle of the night, you're waking up to take supplements, which is, I think it's actually every 3 hours. And Dr. J was like, you don't need to do that. You can get rid of your heavy metals other ways.
Yeah. And so what they're also the owners of Cellcore. So what they're talking about is with the activated carbons, there's a difference between organic heavy metals, which naturally come from the earth, and inorganic heavy metals, which are made from industrial toxins. They're similar to the aluminum that's found in like Roundup Ready. So when you add a carbon to things, they become an organic heavy metal, which is not toxic to the body, and the body can easily excrete. So that's what the activated carbons are about in a lot of their products. That's what they're doing to formulate a non-toxic heavy metal for people to more easily excrete from the body. And what Andy Cutler's program is doing, which I think is wonderful too, is measuring half-lives of certain metals, right? And certain things that he's using to use his vehicles to transport the medical metals out of the system to protect the brain. So he's using a very scientific approach based on the properties of the metals and the properties of things like alpha lipoic acid that he's using to pull things out with, which is great. It's great, but man, it's really intensive. You have to be really proactive. So I would rather err on the side of kind of like opening my body up, opening my lymph up, opening my drainage pathways, my liver, my bile, my lymphatic or brain drain system up. Because if I'm able to sweat and poop and everything is working normally, my body knows how to get rid of those things on its own. My body's not stupid. It's just
and that's
stuck.
why some people don't have effects from these things. We're all being exposed. Some people are getting super, super sick from it and getting all these repercussions. And then other people are like, I don't feel it at all.
That's me. I'm the latter. You know, I don't feel anything at all, but yet I can go and have a droplet of my blood looked at and still see a bunch of heavy metals in my blood. So just because I don't feel it doesn't mean that it's still not affecting me.
Right. Yes. Yeah. I remember my naturopath when she saw my provocation test. I was thinking like I'm a rare, result. I said, so like, how often have you seen them this high? She's like, all the time. I'm like, oh.
And I'm like, I'm shocked. Yeah.
She's just like, everybody has them. And I'm like, I guess so. Yeah.
People think it's a mystery as to why we age. This is literally why your mitochondria are producing reactive oxygen species all day, every day, which age you, is because they're helping to detoxify heavy metals, helping to detoxify man-made chemicals. And that the byproduct of detoxification is reactive oxygen species. Oxidation is what ages us, right? So people think we don't have a root cause to aging. Oh, yes, we do. Oh, yes, we do. I actually have the belief system that we live much, much shorter than we used to in ancient times. I actually truly believe that. I'll probably get shot down for saying that on this podcast. I'll probably get canceled. No. But yeah, I think way before industrial times, there is evidence that our ancestors did live much longer than we used to. And that isn't outrageous to think of just because we've been told something differently. And man-made chemicals do age us, and they do age our cells. They do.
Yeah. So do the loss of hormones.
Oh,
just going to throw that out there.
Right.
Without your hormones, you're going to be quickly dying.
But you know what kills the hormones? Mitochondrial damage. And you know what kills the mitochondria? Toxins. And trauma and pathogens. Yes. 100%. It's all connected. Yeah.
And what's nice, what the biggest takeaway I think from this conversation is it doesn't matter which one of these you may have. I mean, it does, but you still got to go down to the basics, which is do all of these things that you were just talking about, which is allow your body to get rid of these toxins, because the toxins aren't going anywhere. We're constantly being bombarded by them. I think getting genetic testing is extremely helpful so that you know which of your detox pathways may not be up to par. Like I don't oxidize, but I methylate. I do well with phase 1, but not phase 2. Like there's all of these, that I got from this genetic test. So you can kind of pinpoint, but the basics are still there. That foundational piece of open up your drainage pathways, give your body the support that it needs so that it can clean out all of these crazy toxins and stealth infections that we're being exposed to.
Amen to that.
Amen to that. So where can people find you? And you have a private practice, so you do see people one-on-one.
Oh, no, not anymore.
Not anymore? Okay.
Not anymore. Okay. I have since retired. So
good girl.
So now I just have my membership, right? I know. I found that I was repeating myself every single consult. And I was like, how could I say the same message and broadcast it out to a larger audience, which is why Wellness Plus was born. So that is where I do bi-monthly webinars. I have professional courses. I have root cause quickies. You guys write in and say, what's the root cause of this and what solutions? I have 3 doctors that help me do that. We have a community forum, so it is not censored. You can say what you wish on there. 3 doctors answer you on there, including myself. We have a store and with vetted products, lots of things that you guys can order on there, including consults with my doctors in that app, just not me. Sorry. And then also my other website, drjessmd.com. That is just where I have a ton of free blogs and information if you like to read and look at information that way. And then my membership is Wellness Plus, and that's at app.drjessmd.com.
Great.
Yeah.
And is it for people that are suffering with a lot of what we talked about today? Is that your focus in the membership group?
It's really anything. I do a lot with hormones too. We do a lot mold, Lyme, parasites, environmental toxins, all that stuff plus more. We do a lot with just labels and conditions that have been labeled and where that might be stemming from as well. We're trying to, I would liken it to almost like a library or a holistic WebMD.
Right. Yeah.
So,
Awesome.
yeah.
Good for you. That's great.
Thanks.
All right. Well, thank you for coming on the show and for allowing me to ask you a bazillion different questions.
You're awesome. No, thanks for having me.
All right. We'll have to have you back again, Dr. Jess. Thanks so much for coming on the show.
Thank you.